Our top story is going to be telling you all about dementia, the umbrella disease that it is. What are the different kinds of dementia? How is it that Alzheimer's disease is the most common kind of dementia? How does it really happen? What about the cure for it? Here's more. Chris Hemsworth, Bruce Willis, the two actors are known across the globe for having given powerful performances. But in the last couple of years, they've brought into the discourse a debilitating disease. It's the conversation around dementia. Let's talk about that. In February of 2023, there were numerous reports of Die Hard star Bruce Willis battling Alzheimer's. A few months prior to that, Hollywood actor Chris Hemsworth also shared that he was predisposed to Alzheimer's due to having a specific gene. So what exactly is Alzheimer's disease? The seemingly evasive disease is part of a broader condition called dementia. It is a progressive disease. The situation worsens with time. There are different types of dementia, including Alzheimer's disease, Lewy body dementia, frontotemporal dementia, and vascular dementia. And symptoms may vary from person to person. What do the numbers really look like? Let's get you the figures. 55 million people across the world suffering from dementia. Of all the dementia cases, 60 to 80% are accounted for by Alzheimer's disease. Alzheimer's disease is essentially a brain disorder that affects your memory and thinking skills. The nature of the disease is such that it can progressively impede your ability to carry out even the simplest tasks. So what exactly does Alzheimer's do to your brain? What causes it? Let's talk about the reasons. Scientists believe that Alzheimer's disease is caused by abnormal deposit of proteins in the brain. These deposits are called plaques and tangles. Plaques are made amyloid protein deposits in the spaces between neurons or nerve cells in the brain. Tangles are bundles of fibers made of tau protein that are deposited inside the nerve cells. These abnormal deposits damage the neuron, impede the block communication among the nerve cells. The lack of communication causes neurons to degenerate and die, causing brain atrophy or shrinking of the brain essentially here. What happens to patients then? This causes symptoms like memory loss, cognitive impairment, vision, spatial issues, impaired reasoning or judgment. As Alzheimer's worsens, patients start losing the ability to discern smells. There's memory loss, confusion. Someone suffering from Alzheimer's may find it difficult to do daily tasks like brushing your teeth, getting dressed, taking a shower. All of this can be challenging. Paranoia, impulsive behavior are other symptoms. Some other patients may completely lose the ability to communicate. Certain genes can cause Alzheimer's like APP, PSEN1, PSEN2, or in the case of Chris Hemsworth, for example, increase your risk for developing Alzheimer's disease through the APOE gene here. Difference between dementia and Alzheimer's, both are the same. Alzheimer's is not the same as dementia. Dementia is not one specific disease, but an umbrella term used for a combination of various symptoms like confusion, forgetfulness, lack of concentration. These symptoms are caused by damage to the brain and nerve cells. Symptoms could have many causes, including Alzheimer's disease. There are various forms of dementia which are often grouped by their commonality, like their cause or which part of the brain has been affected. Now, since both Alzheimer's and dementia are complex, not much known is about their treatment. Currently, there is no cure for Alzheimer's, though antibody therapy like lecanemab can stop the progression of the disease. Now, therapies have been earlier used to slow down symptoms, but were actually discontinued by the manufacturer Biogen in this case due to its side effects. When it comes to dementia, it's not treatable, but it is reversible if it is caused by lack of nutrients or as a side effect of medicines. It's also treatable if it is caused through infections and immune disorders, metabolic or endocrine problems, subdural bleeding, which is bleeding between the surface of the brain and the covering over the brain, or brain tumors. Research continues over causes and treatment of the disease. Experts say that healthy lifestyle habits such as a good diet, exercise, abstinence from smoking and excessive drinking, reducing stress, and even mentally stimulating yourself may play a key role in reducing the risk of Alzheimer's disease and other types of dementia.